If you had the knowledge and a simple procedure to prevent illness and disease, would you be willing to use it? It is estimated that 90,000 people per year lose their life in from nosocomial infections. And nosocomial would be within a hospital or an institutional setting, maybe a nursing home, that sort of thing. That's quite a significant number. I'm going to share information with you that hopefully will motivate you or persuade you to practice the simple act of hand washing to assist in the prevention of disease within your family and within your communities. I will introduce you to an organization that encourages a proactive approach to assist communities to embrace the simple but profoundly simple act of hand washing to inhibit the transmission of disease from person to person, and I will share information from the CDC concurring with the information communicated. The spread of infection and prevention of infection. Okay, and here's a quote. 90,000 of 98,000 patients who die each year in hospitals are due to nosocomial infections. These infections are preventable with closer attention to hand hygiene and infection control guidelines by all healthcare workers. Traditional infection control looks for a denominator in infection rate. The new era of patient safety is asking to remove the denominator and approach zero nosocomial infections. Quite the challenge. This will require more comprehensive patient safety and infection control, programs that adequately address the significance of changing human behavior and the role our hands play in the spread of disease. Another quote I'm going to read to you from a study out of England. These individuals found something very significant and might be quite uncomfortable for us. Hand washing with soap, hereafter referred to as hand washing, has been ranked the most cost-effective intervention for the worldwide control of disease. Pretty significant when we think about it. It doesn't cost anything but soap and water. It could save more than 1 million lives a year from diarrheal diseases, prevent respiratory infections, the two biggest causes of child mortality in developing countries. In developed nations or countries, hand washing is important in preventing the spread of viral infections, including norovirus, rotavirus, and influenza. It also prevents the spread of hospital-acquired infections such as methicillin-resistant Staphylococcus aureus, and Clostridium difficile, which is an explosive diarrhea. I mean, if you've heard of that, we've had some recent cases in the Milwaukee area in the last couple of years, and it's not a pleasant experience for those who are experiencing it, but it's also quite infectious too, so that's an important point. A recent study that we concluded in the United Kingdom showed that a quarter of commuters sampled had fecal bacteria on their hands. However, we still do not know the most effective way to encourage hand washing. My research led me to a foundation that is committed to reducing illness and disease by educating people in hospitals, schools, and organizations that want to educate within their communities on the effectiveness of the simple act of hand washing. I'm going to introduce you to the Henry the Hand Foundation. This foundation was started by a doctor. He's a family practice physician out of Cincinnati, Ohio. And he started this foundation in 1999, and again, against that simple concept of hand washing and the prevention of illness and disease. Henry is the champion hand washer. Okay, so that's important. Henry starts out with 4 basic principles of hand awareness, and that's the term they use. You want to be aware of your hands, okay? And one is to wash your hands when they're dirty. Do not cough into your hands. Do not sneeze into your hands. And above all, do not put your fingers in your eyes, nose, or mouth. And that is referred to as the T-zone, and that is the eyes, the nose, and the mouth. So in a simple procedure, if you were to look at some of the website and see the videos, the children are taught very simply to keep your hands out of this area, because that is the transmission of those respiratory illnesses that they so much incur in the hospital setting, the home setting, the school setting, that sort of thing. So I'm going to again show you some of the posters that Henry does, and these are a program that he'll put into the hospital or to the school, whoever requires them, and of course there's some costs to that. But one of the posters is, "Thank you for washing your hands upon entering our facility," and he highlights the 4 principles of hand washing, okay, reminding people of the importance of that. And then he has a poster also that kind of says, "Do you have any idea what germs could be on your hands?" And ick, there's a bunch of monsters there that crawl onto our hands. If we're not cleaning them, these are the things that can make us sick. Give you an example of some of them. One is bacteroids. If you don't wash after using the toilet, we can give you an ear infection, those kind of things. So that's all educational for the children and for the adults too. It's as simple as he has his situation here. It's good to see. And then we have one, again, what I emphasize on the T-zone. Understanding that the mucous membranes of your eyes, your nose, and your mouth are where germs enter your body. We don't talk about that much, but that really is the only place that disease can enter in, okay, on the respiratory side of things. So again, we have the 4 principles of hand awareness. And did you know that December 5th and 11th, December 5th through 11th, the week was Hand Washing Awareness Week. And Henry also had a poster for that. So we have an annual Hand Washing Awareness Week, and that's an important aspect to, community health, to well-being, and all those things that go with that. I want to transition with the CDC, or the Center for Disease Control, concurs with Henry the Hand and his advice, and also offers its own advice for hand hygiene. And the CDC goes into a little more detail than just the 4 principles, but the 4 principles incorporate what the CDC has to do here. And they say, how do you wash your hands? Well, if you don't know how to wash your hands, I'll do a quick demonstration. If you had some soap here, you're going to turn the water on, you're going to put the soap in your hand. You're going to vigorously scrub for at least 15 seconds at the least, but the CDC says 20, but we say 30 at our workplace. And here's our little chart of our reminder. Beyond the soap and water, we also use the alcohol gel. And so that is in between patient service. Again, when we're seeing a patient, we want to clean our hands. After we see a patient, we're also cleaning our hands, and everyone carries a bottle of alcohol wipe with them. But at the end of the process of cleaning our hands, we've got soap and water, we're rubbing vigorously. If you don't know if you don't want to count to 30, you can use a little happy birthday song. Happy birthday to you. And then afterwards, you use a towel. Wipe the hands, turn the faucet off, and some people even suggest that as you walk out the door, you use that on the handle also if they're not disinfecting, and then toss that into the garbage. Simple way to do that. Now, when should we wash our hands? Okay, and the CDC has its details in reference to before and after preparing food, before and after eating food, after using the toilet, after changing diapers or cleaning up a child who has used the toilet. This is significant in third world countries. They don't have these type of etiquettes often, and so you have to go and teach that sometimes they believe that fecal matter is non-contaminated. It doesn't have that, and that's a very important part of it. Even literally with Haiti right now, the cholera outbreak. If they don't have these hygiene things in place, a simple act of washing hands, these things are then transmitted and people get sicker and get sick when they don't need to. Before and after attending to someone who is sick, after blowing your nose, coughing, or sneezing, after handling an animal or animal waste, and after handling garbage. Before and after treating a cut or a wound. And that's significant for everybody, in your home, in the hospital, in the care facility. Whenever you're doing any of these things, you should be washing your hands, okay, to protect yourself and those you care for and love. If soap and water are not available, you can use a hand gel to clean dirty or contaminated hands. You want to be sure that it is at least 60% alcohol, and then we're going to demonstrate a little bit of the use of that. At our workplace, we have these. We don't have to touch anything. The alcohol is there. We rub in between the fingers, all the way around, and until when? It's dry. Okay, so we want to make sure the hands are dry. And we do that in between patient use also. All of our staff, again, carries alcohol gel, which they're responsible for maintaining hand health hygiene before and after patient use, patient contact. In conclusion, now that you've been informed, the challenge is to begin to practice and develop the habit of hand washing. That has been proven to decrease, if not totally eliminate. And Dr. Will says that you can eliminate illness with that simple practice, if you can practice it. So if we totally eliminate illness and disease in your own family, as well as in your communities, and I challenge you to develop that habit of hand washing.